Hello, everyone, and welcome back to Santé Mental. Today, we are discussing a very important topic that affects millions of people around the world: understanding serious mental illnesses that require treatment. In our previous discussions, we talked about mental health and mental problems. We explained that everyone has mental health, and sometimes people experience emotional struggles because of stress, disappointment, grief, pressure, or life difficulties. But today, we are moving one step deeper. Today, we are talking about mental illness. The goal of this presentation is not to judge anyone, scare anyone, or label people. The purpose is to help our community understand the different levels of mental health and the possible consequences when mental health struggles are not addressed properly. Many people suffer in silence because they are afraid, ashamed, or misunderstood. Some people think mental illness means weakness. Others believe people should simply pray harder, be stronger, or snap out of it. But mental illness is real. Mental illness is a medical condition that affects how a person thinks, feels, behaves, and sometimes even perceives reality. Just like diabetes affects the body and heart disease affects the heart, mental illness affects the brain. And just like physical illnesses require treatment, mental illnesses also require professional care. The good news is this: treatment works, recovery is possible, and asking for help is a sign of courage, not weakness. What is mental illness? Mental illness is more than simply feeling sad, stressed, worried, or emotional for a few days. Mental illness happens when emotional, psychological, or behavioral symptoms become intense, persistent, and begin interfering with daily life. These illnesses can affect relationships, family life, school performance, work performance, sleep, appetite, decision-making, safety, physical health, ability to function independently. Mental illness changes how the brain regulates thoughts, emotions, behaviors, and perception. Some people may struggle to control their emotions. Others may lose motivation completely. Some may experience intense fear and panic. Others may begin hearing voices or believing things that are not real. Mental illness can affect anyone, regardless of race, gender, financial status, education, age, religion, social class. Even strong people, successful people, spiritual people, and caring people can develop mental illness. Why mental illness happens? Mental illness is complex. It usually develops because of several combined factors. 1. Biological factors. Sometimes the brain's chemistry becomes unbalanced. Certain illnesses can also run in families through genetics. Examples include bipolar disorder, schizophrenia, severe depression, anxiety disorders. 2. Psychological factors. Negative thinking patterns, poor coping skills, unresolved trauma, and chronic stress can increase vulnerability. 3. Life experiences. Life experiences can deeply impact mental health. Examples include abuse, neglect, violence, loss of a loved one, divorce, poverty, bullying, trauma, substance abuse, chronic stress. Mental illness is usually not caused by one single thing. That is why recovery often requires professional support and multiple forms of treatment. Common examples of mental illness. Depression. Depression is more than sadness. It is a serious condition that can make people feel empty, hopeless, exhausted, unmotivated, worthless. Some people stop enjoying life completely. Others cannot get out of bed, work, study, or care for themselves. Depression can also lead to suicidal thoughts if untreated. Anxiety disorders. Anxiety disorders involve extreme fear, worry, panic, or nervousness that becomes overwhelming. People may experience panic attacks, racing heart, shortness of breath, constant fear, difficulty concentrating, fear of leaving home, constant overthinking. Anxiety can become so severe that people avoid normal activities. Bipolar disorder. Bipolar disorder involves extreme mood swings. A person may go through periods of depression, sadness, low energy, hopelessness, then periods of mania, extreme energy, risky behavior, talking excessively, lack of sleep, irritability, grand ideas. These mood swings can seriously affect relationships and judgment. Schizophrenia. Schizophrenia is a severe mental illness that affects a person's ability to understand reality clearly. Some symptoms include hearing voices, seeing things others do not see, confused thinking, suspicion or paranoia, difficulty organizing thoughts, emotional withdrawal. People with schizophrenia are often misunderstood, but many can improve greatly with treatment. PTSD, post-traumatic stress disorder. PTSD can happen after traumatic experiences such as violence, abuse, accidents, natural disasters, war, serious losses. Symptoms may include flashbacks, nightmares, hypervigilance, emotional numbness, fear, irritability, avoidance of reminders. Trauma can continue affecting the brain long after the event is over. Eating disorders. Eating disorders are serious mental illnesses involving unhealthy relationships with food and body image. Examples include starving oneself, binge eating, purging, obsessive fear of weight gain. These illnesses can become life-threatening. Warning signs of mental illness. Mental illness usually produces serious and lasting symptoms. If these signs continue for weeks or worsen over time, professional help may be needed. Emotional signs. Severe sadness, extreme fear, hopelessness, intense irritability, emotional numbness, mood swings. Behavioral signs. Isolation from family and friends, dangerous behavior, aggression, loss of motivation, poor hygiene, substance abuse. Physical signs. Changes in appetite, major weight changes, sleep problems, low energy, frequent fatigue. Cognitive signs. Difficulty concentrating, confused thinking, memory problems, hearing voices, seeing things others do not see, suspicious thinking. Emergency warning signs. Seek immediate help if someone is talking about suicide, hurting themselves, threatening others, losing touch with reality, unable to care for themselves, acting dangerously. If it is an emergency, call 911. Call 988 for mental health crisis support. Call 211 for community resources. Go to the nearest hospital. Mental illness is not weakness. One of the biggest problems in many communities is stigma. Some people are judged for having depression, anxiety, or other mental illnesses. But mental illness is not laziness. It is not weakness. It is not attention-seeking. And it is not a personal failure. Nobody chooses mental illness. Many people suffering from mental illness are fighting battles others cannot see. Some are trying their best just to survive each day. Just like someone with asthma may need medication to breathe properly, someone with mental illness may need therapy or medication to help the brain function properly. Treatment for mental illness. The good news is that mental illness can be treated. Many people improve significantly when they receive proper care. Therapy. Therapy helps people understand emotions, process trauma, change unhealthy thinking, learn coping skills, improve relationships, manage symptoms. Talking to a trained professional can save lives. Medication. Some mental illnesses involve brain chemistry changes that may require medication. Medication can help regulate mood, anxiety, sleep, attention, psychosis. Medication should always be prescribed and monitored by a qualified medical provider. Combination treatment. For many people, therapy and medication together work best. This combination often improves recovery outcomes significantly. Support groups. Support groups help individuals realize they are not alone. Community support reduces shame and isolation. Lifestyle changes. Healthy habits can support mental health recovery. Examples include exercise, sleep, healthy eating, stress management, avoiding drugs and alcohol, positive relationships. Lifestyle changes alone may not cure mental illness, but they can strengthen recovery. Specialized programs. Some people may need intensive outpatient treatment, psychiatric hospitalization, crisis stabilization, residential treatment, trauma programs, substance abuse treatment. Seeking higher levels of care is not failure. It is sometimes necessary for safety and healing. Mental illness and physical illness are similar. Remember this important truth. Mental illness is just as serious as physical illness. If you had a broken leg, chest pain, severe infection, diabetes, you would probably seek medical help quickly. Mental illness deserves the same level of seriousness and compassion. The brain is an organ of the body too. Steps to follow if you need help. Step 1. Recognize you need help. Do not ignore the signs. Accept that something may be wrong. Awareness is the first step toward healing. Step 2. Consult a doctor or psychiatrist. Professionals can provide evaluation, diagnosis, medication if needed, treatment recommendations. Step 3. Start therapy or counseling. A mental health professional can help you understand your condition, learn coping skills, manage emotions, build healthier patterns. Step 4. Follow recommendations. Healing requires consistency. Take medication as prescribed. Attend appointments regularly. Practice coping strategies. Step 5. Be patient and persistent. Recovery takes time. Some people improve quickly, others improve gradually, but improvement is possible. Many individuals with mental illness live meaningful, successful, productive lives. Message to families and communities. Families and communities play an important role in healing. Instead of judging people struggling with mental illness, listen to them. Encourage treatment. Show compassion. Learn about mental illness. Reduce stigma. Support recovery. Sometimes your support can save someone's life. Final encouraging message. Mental illness is real, but so is hope. No matter how dark life may feel, recovery is possible with proper support and treatment. If you are struggling, please do not suffer in silence. You are not weak for asking for help. You are human. Healing begins when we stop hiding pain and start seeking support. Thank you for joining Dr.Monval today. Please like, share, and subscribe to help spread mental health awareness in our communities. Together, we can reduce stigma, increase understanding, and encourage healing. Take care of your mind because mental health matters. Please, once again, like, subscribe, and share the video so you can help someone else understand and encourage us to continue producing videos like this. Click the link below to join the Dr.Monval app so you can learn, grow, and live in balance.